The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Well, hello and welcome to House Call. I'm Dr. Richard Jensen. Today I'm here by myself. Dr. Lala is away on assignment. And so I'm going to be covering this part 4 of what is chiropractic for you today. And the first thing that we're going to do is bring up this slide, this phrase, the absence of disease does not indicate the presence of wellness. And basically what we're saying is that there's a difference between vertically healthy and horizontally healthy. I mean, those people who are horizontally healthy, they're on their back, they're sick. And many times let's just say it, they're in bed or in the hospital, something like that. And then there's vertically sick. There are those people who are walking out amongst us that are not quite feeling all well. They don't quite have all the health that they should have or that they're capable of having. These are people that, well, let's put it in this way. The way I can categorize it is you hear a lot about cholesterol levels. And when you go in and they find that your cholesterol level is 200, all of a sudden all the bells and whistles go off and it's like, what's going on? And then, but what happens at 199? At 199, is there a problem? There may not be. But at 199, you're certainly at that crux of what's going on. So the absence of disease or of feeling bad or of the absence of clinical symptoms does not necessarily indicate the presence of wellness in this case. So let's go on from that. And here's another phrase for us. We believe here, this is a ministry that we put on. This is our public service. And so we want to put before you this phrase, that Jesus has healed me of every disease and sickness, and therefore I am healthy and whole. And really what we're looking at is that we have these references from Exodus 23, verses 25 through 26, and 1 Thessalonians 4, verses 13 through 18. And these verses, what we've done is we've put them together and kind of paraphrased them so that they are actually the promises put forth in the Bible for you and for me, and we would like to make those personal. And so by putting that forth to just plant that little seed to help your feeling better, Jesus has healed you of every disease and sickness, and therefore you are healthy and whole. And that's what my hope is for you. So let's go on to what is chiropractic. Chiropractic, first and foremost, we always hear about chiropractors moving bones primarily in your back and with the spine. And it's all about the nervous system. And as we go to this slide, we see what a subluxation. A subluxation is defined as the incomplete dislocation of a bone in a joint. And so if we look at this diagram here for a little bit, and you've seen us go through this before, we're looking at the bones here of the spinal column. And in the back here, there's where the spinal canal is. You can't really see where the spinal cord is going, except that it gives off all these nerves that come out of it. And these nerves travel through these little tunnels that are formed between the two bones in the back, which the bones are called vertebrae. And it travels through this tunnel, and if one of these bones is out of joint, not dislocated, but a little bit held out of joint, and sometimes it's held out of joint by muscles, sometimes it's held out of joint by inflammation in these little joints back here. Sometimes there's just something that's locked it there and it needs a nudge back. And the chiropractor diagnoses that and finds out which specific way to nudge it back to give you a specific adjustment. That's what it is, a specific adjustment to help tune the spinal cord and the nerves there to affect healing the most. So if we go back to this slide, what we find is in between these bones here, we also have a little cushion in between there, which are the spinal discs. And those discs are adhered to this bone. Well, if that's been nudged, if this vertebrae has been nudged out of place enough, you start to tear away that connection between this, and it starts to destroy the disc, and you start to lose some of that cushioning in there. Now, the spinal cord is designed that most of the weight is carried by the large vertebral bodies on the front here, okay? Now, also by moving that back, you constrict this tunnel. And the thing is that when it constricts it, it puts pressure on the nerve. But not only that, what's affected first is actually the vasculature that's coming through there that supplies blood to the spinal cord, and it usually affects it 3 levels above, 3 levels below. So you can have a vast array of different symptoms that can be caused by this one vertebrae being out. Now, if we look a little bit closer at some of these vertebrae, you've seen this model before. If you've been with us for some time, if this is your first time here, we'll just go over this quickly here. But what we see here is the spinal cord, okay? And it's traveling through the spinal canal in the back here, the vertebral bodies here. This is actually called a motor unit. It's the smallest area of the vertebrae that actually has its own movement, because this is a joint, okay? Joint is between 2 bones. And we have this canal here, which the nerves come out. And if you press on that nerve, it can have deleterious effects to everything that is innervated by that nerve. And so as we go on here, we have a different view. You see the spinal canal up at here, where the spinal cord is going through. Vertebral bodies, you can see where most of the weight is on. You see where the joints are here for movement of the vertebrae upon each other, and the nerves coming out here. And these little bony protrusions here on the back and on the other side, what they're for is they are like little levers in which ligaments and muscles and tendons are attached to help control how this spinal column moves. And so we look at those as levers from a chiropractor's point of view as to place this vertebrae back in its correct relationship to the vertebrae above or below it. Okay, so let's look at it from the back side. You can see that these joints that I was pointing at earlier are right here on both sides here. And many times these actually have a joint capsule around them. And if this is out of place, it causes a little bit of more pressure to be placed on one, and when it's irritated, it starts to swell up. And sometimes that swelling in one joint here and not in the other, or in both, can lock this joint in place above this one, lock this bone in place above this one, therefore affecting that there's no motion in here, and can also, by its displacement, be placing pressure on these nerves. And so what the chiropractor does is many times when he moves that, you might hear heard that there's a little bit of a crunching sound or popping sound that's the same as people who crack their knuckles, basically. And what it is, it's a release of nitrogen as you gap that joint, and by gapping that joint, you relieve irritation that's on that joint, and guess what happens? The inflammation goes down, and that since the irritation is gone and the inflammation goes down, you restore a natural motion to that joint there in the spinal column. So then also we see here garbage in, garbage out, really. Not only do what our spinal column affects us, but the garbage that we put into our body that is found in our environment today, there's some uncanny number of new chemicals created every day that get introduced into our environment. And these are chemicals that our body just simply cannot adapt fast enough to recognize. And so some of them are very hard for us to process through. And so if we're called to process these things through and they're very difficult, guess what? There's a lot of signals going through that spinal cord that are trying to get this processing to go, and sometimes an imbalance will form and will cause an imbalance in the spinal cord or in the muscles around it and pull those vertebrae into subluxation. And by pushing those back, it helps restore that function to the nerve and help renewed function to those organs, and in that case, help you to deal with your environment a little bit better. So let's go on. We have some x-rays now of some backs here, and so what we see here is this is, let's see, we have an R here, so we're looking at it. This is the left, this is the right. You're looking as though if you were giving this person a back rub and they're lying down on the floor, you're seeing them from the back. This is their left hip, their right hip. Up in the middle, you see the spinal column. You see a little bit of modeling along here, which is intestinal stuff that's going on. Right over here on the left side, this may be the gastric air bubble. It's a little bubble on the top of the stomach. I can't really make out the diaphragm in this shot, but you see this little ridge here? There's a muscle there. It's called the psoas muscle. You can see it on the other side here. So when we're looking at x-rays, we may also be looking at what's the relative densities of the muscles against the other tissues, because when they're tight, they're a little bit more dense than what they would normally be. So a lot of times, you shouldn't really see these. Now what you see over here is you have some irritation that was in the outside of this disc and the ligaments around it. And when there's irritation that's prolonged over a long period of time, the body decides, hey, I've got to help shore that up to make sure that it doesn't get irritated as well. And so it uses cement. And the body cement is calcium. And what basically is happening is if that is allowed to form along there, if that irritation is not taken away, those two will fuse together, so there will be no motion in that joint anymore. Guess what happens? Then the next one up has to move so much more, and then that becomes irritated. And so that's where we see in practice, where we start to see things, the whole spinal column start to get solid, from the point that the person has this dysfunction in there, and it just propagates further dysfunction. And that's why it's important to have care. Let's look at this next one here. You can see again, we have a lot of this joining here. This is called spondylosis that is occurring, and it's going up a number of segments in this spine. You can see that they have some irritation going on here just by their posture. They've got a curve in here, and that could be from muscle imbalance. But look at this. You have the heights of the hips are at different levels here. And that means that you're putting the same kind of irritation on the spine over and over and over again, because we walk on very flat land, on sidewalks, on floors, concrete. It's always the same type of stimulus in there, and over time that same stimulus, having to deal with that over and over and over again, affects the spine. So it's much better to make sure that they have a good level base, and your chiropractor knows how to handle that. Let's go on from there. Now we have a sideways view of these vertebrae. And you can see there's the vertebral bodies. You've got in between here, you have the cushioning of the disc. This disc is almost gone. And what you find is down here, this is one of the big problem areas here by the amount of pressure that we put on there. And there's something that I want to tell you. The thing that eats these things for lunch here, it's basically what does the most damage to these discs. There's two things, vibration and lifting. That really creates, we find that predisposes those things a great deal. So it's learning from your chiropractor how to efficiently use the spine so as not to create more damage on there, okay? It's finding out how to have good care in the spine. Sometimes it's nutrition that can help that disc stay in good health. You have to look at that. There are no arteries and veins that go directly to the disc. They get their nutrition from all those structures around it, from the bones above and the bones below that have a good blood supply. It's the disc is the largest structure in the body that has no blood supply, and so it just has to perfuse in there. And so by having good nutrition and helping that diffuse in there might help with that disc health. Okay, so let's look at the next one. What we have here, look at the tightness of these muscles across here. Look, it seems to be pulling outside here more, and see how the spine is going this way? Well, look, if you look at the heights of the hips, this one's a little bit lower. So what happens is at the very bottom here, you see the spine's going this way. It's got to be pulled over this way by the muscles. It usually overcompensates and then has to compensate back. So that's where we look at the biomechanical alignment of the body and help restore that, so that you're not trying to correct for all these things. And the more things you correct for, the less things that your body are having to correct, and it allows more energy for affecting towards life and increasing your vitality. Let's go to the next one here. We have quite a few of these x-rays, by the way. If you look over here, there's a lot of modeling in here. Guess what? When you have some problems with the nerves, these affect the intestines, and sometimes it affects how well you're digesting. If you look at also with this curve in the spine, look at the ribs here. See how wide the ribs are apart here and how much closer they are over here. And there's probably showing me that there's another backward curve coming up here. If I had another shot that showed up higher, what happens is, what's up behind the ribs? That's your lungs and your heart. And if you look at that, in this case, it's going off to the right side, so you're looking that the lung there actually has less room for its function. So you might have less function of your lungs there, less air going in, and therefore your vital capacity is lowered. The same thing when you're looking down at the down below on this slide again. If you look down there where we have this modeling here, you can see where the digestive function in the intestines is also being compromised. So you can see how affecting the spine and affecting your posture affects all these organs in here. So the absence of disease does not necessarily mean the presence of health. It's to go in and be analyzed and really see what's going on inside. It's not just a superficial exam, it's trying to go in there and really determine how best to help this individual to help heal themselves and restore vitality. Let's look at the next slide here. Here we have, again, a sideways view, but I want to look at up here. See, this is the artery that comes from the heart down to the legs. It's called the abdominal aorta, and it actually starts to split here or bifurcate around by the belly button, and that supplies all the blood supply down to the legs. And so having some tension there, this one I'm not so worried about. It doesn't have a lot of calcification. It's just starting here. And I'm not sure about the age of this particular patient. Sometimes that's a little bit normal, but when it starts early, such as when people who are smoking, look at, here's where the damage occurred, and here's where the calcification has started. So it kind of starts to work together in there that there's inflammation, and with inflammation starts atherosclerosis that occurs there. Let's go on to the next slide. Again, we're having problems down there. You can start to see where we've got a lot of modeling, a lot of inflammation that's going on in here. We'll go on to this slide here. Here's some atherosclerosis that is occurring in this spine, in this abdominal aorta. And you can see where the calcification has occurred here. Not only that, but look over here. They've had a lot of inflammation along those ligaments attaching that disc, and it's just shoring itself up with the calcium along here. It's not only here, but up here. And you can see the internal structure to this disc also. This in here is called the nucleus pulposus, and it's kind of like a disc has kind of the structure of a jelly donut. And it has a hydrostatic structure to it that the outside has kind of the consistency of crab meat, okay? And that it has a lot of turgor to it. But inside, there is this, the jelly filling, shall we say, is liquid that helps hydrostatic pressure for the pushing down. God was a great engineer when he designed the body. And so within that helps distribute that pressure along there as well as keeps the motion in there. So what we're finding is not only is this person here, if we go back to the slide, calcifying that nucleus pulposus, but it's also, they must have had some problems with the disc. It's starting to calcify around here to shore that up, which will take away the motion in there. And then what we'll also see is the calcification of this abdominal aorta that's going on. So this person has some metabolic problems, not just structural on here. And this is more of an aged person on here, but if we go to this next slide, this is a very young person. This very young person, if you can see here, they've got this large scoliosis that's going on, and look what's going on over here. They have all this problem with their intestinal tracts. In fact, this person had a lot of problems with having a bowel movement, and so it wasn't diarrhea, it was constipation, and so they're having a really hard time with that. And what happens is with good spinal care, good biomechanical alignment going on. This patient then turns into having a nice straight spine. It's the same person. You look at how the intestinal tract is much, much better here. And so this person then is restored to that. And guess what? When a child has constipation like that, they're just not the child that you knew. They're always dealing with this thing, always having this kind of feeling in here. And then next thing you know, you get these comments from parents and grandparents that you've restored my child to me again, that they have this great personality that's come back. They don't fret sitting down at the dinner table. They're able to eat hearty now, and which food is very important to a child's growth and getting them the nutrition that they need to have a healthy brain and a healthy body. So this is what's very rewarding to me as a practitioner, is seeing some of these things happening within the clinic. So then next we look at some of the damage that can occur internal. And what we have here is an MRI, and what we're looking at here is, if you're looking at the discs, these discs are actually bulging backwards towards the spinal canal. See, it doesn't just happen on the front, but it happens in the back. And guess what? It puts pressure on the ligaments. There's a ligament that comes all the way down the spine here and all the way up the spine here. And these ligaments are highly innervative for pain. Now, if we look at this next slide, it's showing what a near normal vertebrae is. This one actually has a little bit of a problem with it. You're starting to see where on the bottom here, you can't really see the disc space down on the x-ray because it's so collapsed down in here. But the rest has good disc space. You're starting to see where there's a little bit of a misalignment here, which could be helped by good chiropractic care. There's a little bit of a misalignment starting here. But look at this. You've got wide open tunnels up in here for their nerves, and it's starting to get pinched back here, and even gets smaller. And as we get down here, they have much less room down here. And that's going to your genital urinary area and down to your legs. So this person could very well be helped. Then let's go on to the next slide here. This is even more dysfunction that's going on here. You can see there's more. Remember how we said when this one goes away and it gets all calcified, then all the motion has to come in here. That starts to get inflamed, so they start to calcify there, and it starts to have a problem there. This is the next one that'll occur. So these problems just work their way right on up the spine, and that's some of the things that, if you already have these problems here, it doesn't mean that you shouldn't have care. It means that what you should do is have care to stop from progressing all the way up the spine. Next, you can see where the dysfunction is there. They actually lost all this first internal curve that's supposed to take place. It's called a lordosis, that sway in the low back. You're supposed to have some of that, and so they're losing a lot of this. And see how the kind of wedging that they're having going on there, the loss of these tunnels for their nerves, and it's really about restoring that. Remember, I told you, chiropractic, a lot of times you're telling us that we look at the bones, but it's all about the nervous system and restoring function. And once you've restored function, it helps preserve the bones. Interesting, huh? It all kind of swings around. See, we look at the body as a whole, not just a part to be, to be isolated, to go in there and cut things out. And medicine does that great. In fact, they've restored a lot of function, and there's a great place for that. But when we're looking for overall function, okay, we're not looking at fractures and having to restore just one area, but when you're looking for overall function, the chiropractors are very, very good at helping with that. Okay, and there we're looking at even more dysfunction. And let's see here. This is even more dysfunction in there, and there's a regular spine. So you get to see the difference here between something that has been degrading for a long time and what it is at near normal. So now you can recognize those things there. So let's look at this lumbar spine number one. Remember, we've got these nerves. They affect different areas of the body. And let's quickly go through what these things can affect. L1, what you see on the arrow there where the level is in the spine. The areas of influence include the large intestines, the inguinal rings, which is down where you would normally see where people would complain about having hernias. Inguinal rings is right where there's that crease is that attaches the leg to the body. So effects include constipation, colitis, dysentery, diarrhea, some ruptures or hernias. We're looking at L2. The areas of influence include the appendix, abdomen, upper legs. So if you're having these kind of restless leg syndrome kind of things, sometimes it can be this lumbar spine that needs to be corrected to help those feelings. The effects of L2 would include cramps. Oh, look at menstrual time for these women where they have cramps. The L2 is real good for that. Difficulty breathing. Minor varicose veins can come from L2. L3, areas of influence include the sex organs, the uterus, the bladder. Guess what? If you're having trouble conceiving, L2 or L3 might be a great key to that, restoring that nervous energy to it and restoring function to the area, and it can be a great help in helping you with that problem. How about its effects include bladder, knee, menstrual and menopausal problems, miscarriages, bedwetting, and impotence. L4, areas include prostate gland, low back, muscle, sciatic nerve. It affects sciatica, lumbago, difficult, painful, or frequent urination, and backaches. L5, it goes to the lower legs, the ankles, and the feet, and it can affect poor leg circulation, swollen and weak ankles, weak legs, ankles, arches, cold feet, and leg cramps. So it's very important for your structure. How about S1, going into the sacrum? It includes your hip bones and your buttocks, and effects include the sacroiliac conditions and spinal curvatures. S2, it includes the rectum and the anus. If you're having problems there, such as with hemorrhoids or anal itching, painful tailbone while sitting, these are all things that can be included in there. And as we look here at this structure here, where you're looking, your chiropractor will look at what's going on there. You can see they've got a low side on the hips, on the left side, and normal on the right. Guess what? It's 10 millimeters off. And with 10 millimeters, we find at 5 millimeters difference, it starts pain. At 10 millimeters, it starts dysfunction of the joint, and that the joint actually starts to wear away. And there you can actually see on that photo where they've had a hip replacement that has occurred there. Let's go on to the next. There's further. Wow, this spine is really off and can probably have a great deal of care from that. Well, then let's look at the scriptures again. By the authority in the name of Jesus and the flow of his blood and the word within me, I am healed, healthy, and whole. And this is the kind of seed that we want to put in you, that you can take in your heart and have that effect healing with you. And what we find here is the word of God is like a seed. And Jesus explained it here in the red letters that we find. This is what the kingdom of God is like. It's a man scatters seed on the ground night and day, whether he sleeps or gets up, the seed sprouts and grows. He does not know how, and by itself the soil produces grain. What we're looking at is that seed will develop. And faith comes by hearing, and we look at, consequently, faith comes from hearing the message, and the message is heard through the word of Christ. Do not be deceived, in Galatians 6:7. God cannot be mocked. What a man reaps or harvests is what he sows. And so again, we like to put into you that by the authority in the name of Jesus and the flow of his blood, the word within you, you're being healed, healthy, and whole. We thank you for this time that you've allowed me into your house today. Be good health to you. God bless.
Visit our website